Douglas Finance Committee, February 10, 2026. Let's just go around the room or the table and identify ourselves. But Heather, we'll start with you, okay?
Sure. Heather Ward, Finance Committee.
Rob Leonardi.
Carol Gogolinsky.
Dick Vandenberg.
Ryan Hogan.
Sandy Kuipers.
Lynn Mazzulli.
And Mike Hutnick is absent with notification, and Howard is supposed to be coming later, so we'll wait for him. So, all right.
No.
Let's begin. Fire folk, you want to come to the chairs?
Hello, everyone.
So identify yourselves for the record, please.
Yep. John Furno, Fire Chief.
Kelly Manning, Deputy Fire Chief.
So everybody had a chance to read over what was shared. So, John or Kelly, you want to just hit us with the high points of your handout?
Yeah, sounds good.
I don't think we need to go through every item, but...
No, absolutely. And if there's anything you guys have questions about, feel free to ask. Also, feel free to stop by the fire station to talk about any of this. We operate out of 2 budgets, so sometimes it can get a little bit complex, but our goal tonight, just give you a clear snapshot of our current fiscal year 2026 budget and how we're doing, and discuss some short-term and long-term issues that we'd like to address strategically in fiscal year 2027 and beyond. So I appreciate the questions you posed to the department, so I'll just go through those quickly. So the first one, how is the current budget performing compared to the assumptions made when it was submitted? I think it goes without saying everybody's budget's under pressure compared to what was submitted due to rising costs. We've had a bunch of unanticipated expenses this year. And then, as you know, our department relies on grant funding, which due to a lot of the government shutdowns and those sort of things, we're just a little bit behind the 8 ball there. The good news is the grant application period's just opened. So some of the grants that we've gotten in the past, we'll be able to apply for those again. So hopefully in the last quarter of fiscal year 26, we'll see that funding coming through. So just to talk about that, in fiscal year 25, we were awarded approximately $29,000 in grants. And I expect that number this year to be slightly less, approximately maybe 25. So still a decent amount of money, and some of those costs are used to purchase turnout gear, hose, and other various pieces based on our expanding missions, wildland fire PP, ballistic gear, that sort of thing. In terms of rising costs, one area that we've seen an exponential increase is just the cost of turnout gear. When I started in fiscal year 2021, the cost of a set of turnout gear, so just the coat and the pants was $2,300. It's now, I just got a quote the other day, and the chief and I played a little Price is Right, and he guessed under, but it was $45.28 for a set of gear, and that's the new PFAS-free compliant gear, which will be required to purchase in fiscal year 28. Right now, we can still buy a set that doesn't meet that requirement for the low cost of $4,000. A bargain. So,
Kelly, can you tell the lay people what turnout gear is exactly?
So it's the firefighter coat and pants that we wear when you see the outfit, yeah, the uniform.
That doesn't include the helmet or boots.
Or gloves or the other.
Or gloves or a hood.
Okay.
So.
Is there anything in particular that's driving these price increases so dramatically?
I think it's the cost of materials, the shipping costs. I know we've experienced issues with tariffs. We were looking at another piece of equipment we had quoted, and I said, guess the tariff, and it was $2,000 a tariff for an extrication tool, which like the jaws of life to cut somebody out of a vehicle. It's crazy, and we have a lot of expensive pieces of equipment at the firehouse, so when you start adding costs like that on everything, it makes it very difficult, and we have to prioritize. We did unfortunately have some anticipated costs this year, and the chief can give some more perspective in terms of our vehicles. Engine 3 was out of service for an extended period of time due to some fuel issue, as well as our Engine 2 that had an issue with the computer that runs the transmission.
Yeah, the ECM let go, I'd rather go back to the old days car where we would stand and shift and not worry about that stuff. But the computer that runs the transmission in the 2001 truck, there was a $9,000 cost to get that repaired. Just out of the blue stop, it wouldn't go in and out of gear. So we had to get it towed up to the dealer and have that repaired. Engine 3, as the deputy talked about, we've been fighting a fuel issue since that truck was brand new. It would lose prime, meaning every time you go to start it, it's a diesel. The fuel wasn't in the filter to get to the engine. So I believe we finally, Cummins and Dedham finally figured it out for us.
Was that a new engine for us?
Well, it's a 2017 model.
Okay.
So there's been fuel problems, honestly. I think that truck was built early Monday morning after the Super Bowl. I'm pretty sure. We got it back December 23rd, and there hasn't been any issues with the fuel problem. So I think we finally have it solved. But that truck alone, we spent $14,800 on that truck in the last fiscal year on repairs. But to replace that truck now, I just got a quote. It's $1.1 million, and it's a 4-year wait.
Wow.
So, so you've got to do the investment and try to keep it on the road. A new ladder truck now is probably close to $2 million in a 4-year wait. Just to throw that number out there. So I'm sorry.
No, you're good.
Yeah.
Our heating system, our boiler, has experienced some issues, and we put about $5,000 into it this year. We'll talk about it a little later in the presentation, but it's slated to be replaced with that project going out to bid in the spring. So next fiscal year, we don't anticipate spending any money on it other than the cost of the maintenance contract. Some other unanticipated costs due to some personnel issues. We had a resignation of a firefighter EMT in the fall, which created a vacancy, which increased reliance on overtime use and hiring of part-time personnel to fill that slot, and those folks are paid at a slightly higher rate than that person that had left us, so there was a gap there that we had to make up. We have one member who's in the armed forces, again, requiring overtime and part-time coverage at a higher expense. And then we've also had an increased use of paid time off benefits, as we have one member currently out on FMLA leave, and those are just things we couldn't plan for. So that's just some of where we're at based on what happened during the fiscal year. Those are some of the big highlights. Are there any questions before I move on?
Yeah, Kelly, the whole grant funding, is that historically an up and down thing, or is it noticeably less than other years, would you say?
It's noticeably less. So there's a big grant program, a federal grant program called the Assistance to Firefighters Grant Program, and that is the grant program we actually got funding for our brush truck out of. And historically, those are big, very large dollar figure competitive grants that we've been very successful in, and the federal government, due to being shut down and not wanting to put funding in that area, there just hasn't been an opportunity. That hasn't even been up for application probably in the last 12 or 14 months, and that would be something that I would typically use to replace a bigger ticket item of ours. For example, our extrication tools, which we have a 35-year-old set that we're looking to try to replace, which would be competitive in a process like that.
Is the state in any position to pick up some of the slack or not?
Yes, they are, but at much less of a dollar amount. So there's a grant program right now that we're applying for a maximum of $15,500 that we can use to purchase an extrication tool. However, it will only cover part of the cost of the tool, and the rest we're planning to fund with donations and some other fundraising efforts.
So the federal funding was higher?
Oh, yes.
A lot higher?
Yes.
Okay.
And back in the early 2000s, our ladder truck was actually funded from an Assistance to Firefighters grant. So our town has benefited, and our self-contained breathing apparatus, the ones that we currently have, we got a Assistance to Firefighters grant in 2015 for just under $200,000 to replace that, so those costs were never felt by the taxpayer. So for a small community like us, not having the opportunity to, offset the capital budget with that it's a really big hit.
No, through the chair.
Go ahead, Sandy.
The extrication tool, I realize the age probably will answer the question, but what's the reason for replacement?
So the reason for needing to replace an extrication tool is just the technology then versus what it is now. The new tools have the ability to cut through the high-strength metals that are in the newer cars, whereas this tool may not be able to. We do have a newer set of tools from 2012, which is still outdated in terms of cutting some of those higher strength metals, like boron is one of the metals used in the cars now. And oftentimes at a car accident, we may need more than one set of tools working. So we've had several serious car accidents where we've needed multiple sets of tools because we've had multiple vehicles with multiple patients pinned inside, in which case we would rely on our mutual aid. But if, we can start working right away and have that second set of tools be high strength and ready to go on the new vehicles, that's obviously advantageous for the patient who's probably seriously injured, trapped in that car.
Thank you.
Okay, carry on.
Okay. In terms of highlights of the current fiscal year, we ordered an ambulance, and that's expected to arrive in December of 2026 to replace our 2018 A1.
Are these brand-new vehicles then?
That is a brand-new vehicle.
Do we dare ask what sticker price is on a new ambulance?
So we did homework, and the chief was able to source a very competitive price, and he was also able to, at the same time, put in that sort of package 2 new cardiac monitors. So the ambulance itself was $306,
Yep.
and that doesn't include the cost of the stretcher and the mounting bracket, which is close to another $100,000. Yes. But in comparison with other ambulances that are out there, some of them are going for $500,000, $600,000. So that is a very good price, and it is the identical truck to the 2018 and 2019 that we have that have been very good for us and reliable. So don't take that less expensive cost as us getting an inferior product. It's going to be very good for us. Like I said previously, we took order of 2 new cardiac monitors, which have been fantastic for both the patient and the paramedic. These monitors have offered some enhanced pediatric care features and more advanced data interface with our computers and data just coming at the paramedic. And why that's really important is for somebody, say, potentially having a heart attack, calling the ambulance with chest pain, it allows us to detect changes in somebody's EKG much more quickly and in real time than our previous unit. And that's important because we're 25 miles away from UMass, which is the hospital we have to take patients to who may be experiencing a cardiac event. So that's been very positive. I'll let the chief touch on some of our building and equipment highlights.
So this past October, maybe you noticed, we got our roof replaced. That went out to bid, and we had $75,000 for the project. It came in at $57,500, and we were able to get the roof replaced on the station. At the fall town meeting, we got the funding approved for the HVAC and electrical. We're working with the town administrator and Weston and Sampson to get that package together. We hope to put it out to bid in early April and get the work done this summer. So we'll finally have the electrical upgrades, the HVAC, the new generator that we've been working on for several years to bring us into more modern times.
Our Carl Fire Department, I can't say enough good about them. These guys are awesome. They show up, they're committed. It's really important that we maintain that strong call fire department. Looking at some of our call data, it's remained consistent since 2022, our call volume. We do about 1,250 calls annually, about 80% EMS, 20% fire. An interesting trend that I noticed was 19% of our calls occur simultaneously with 2 or more calls happening at the same time. And that's where the call department comes into play in terms of taking a second ambulance call, which they just did about an hour ago. Also, our average response time is well under the recognized standard that we should be aiming for, the NFPA 1710 standard, which says that we should, from time of call to getting on scene, should be under 8 minutes 90% of the time. We're currently at 80%. 80% of the time we're there in less than 8 minutes, with our average response time of being just under 5 minutes. Given that we don't have career staffing, that's why we're not quite at that 90%. If we have another call, the call people have to come in from home, and also keep in mind that our town is 37 square miles. So, you know, if we're responding out to like High Street, it's a 10-minute ride even with lights and sirens.
So Kelly or John, can you just tell us real quick, how many people are in the fire department right now? How many are on the payroll, would you say?
About 30.
30 total. We have a strong 18 call member department, very strong, probably the biggest call department we've had in a very long time, if not ever. So
We currently have one member that's finishing the Call Fire Academy, will graduate in March, who's also an EMT, and then we were recently able to recruit a firefighter paramedic who's a career firefighter in a neighboring community who lives in town to come work for us. So that was huge for us. So we're really ecstatic with the participation of the call department. And I also want to add our career fire department that lives in town. If they're home and they're able to respond to emergency, they come out like our call department does, and I think that's important because that hasn't always been the case. Our career staff has not always lived in town, so.
Of the 30, how many live in Douglas, would you say, more or less?
20,
yeah, I'd say 20 is a fair
Okay.
number. Yep.
or they're right on the town line and they're able to respond to callbacks. One major goal for us is to be engaged in the community and have the community have the opportunity to interact with us on, not in an emergency, because that's not as fun sometimes. So fire safety education for students and older adults and some home safety visits, those have been covered under a grant program that we've applied for every year, and that's a total of about $8,000 or $9,000 in funding. So we get to visit the senior center, actually go to senior citizens' homes and check their smoke and CO detectors or put up a lockbox. We get to be in the public schools, visiting the first graders, the third graders. Occasionally we go into the high school and visit the 10th graders as they're starting to think about college and their adult life. And then another neat opportunity we had in the last year is to do free public CPR classes utilizing opioid settlement funding, and we've trained about 50 people so far. So those are people in our community that could make a difference in the event of a cardiac arrest. Most of the time, if you're going to survive a cardiac arrest outside of the hospital, it's because you got CPR from a bystander. So we're really proud to be able to provide that training.
How often do you do that program?
We try to do it about every other month, depending on what's going on. So I hope that we'll put a class out sometime the end of March, beginning of April.
Where do you advertise that?
We advertise on our social media pages, so you can find us on Facebook at the Town of Douglas Fire Department, Instagram, Twitter or X, and we also have the Douglas Emergency Management Facebook page, so they usually go up there. And our friends over at Team Blue will also share it for us. So,
Is opioid settlement money finished, and is all of it related to the fire department?
it's not finished, and it's not all related to the fire department. We're also part of a collaborative group within the Blackstone Valley where we do other activities to minimize the harm reduction from opioid use in the community. So we're in a group that puts some money in the pot to offer other services to people in the community that may need it.
Is that a chunk of change or not, the opioid settlement?
It's a chunk of change. I would have to check with,
And how many more years will that be available to us?
I would have to get back to you on that.
But a year
Several.
or like
Several,
5 or-
several, like,
Okay.
I believe.
Matt shaking his head.
No?
Is that running out, Matt?
10 years.
Yeah.
Really? And is it reliable money?
It's a settlement. It's funded.
Carol?
Was that money that came back with all that oxycodone that they were
Correct.
throwing out? And then they found out they were making these people pay? That's where that money comes from? Okay.
Yeah.
Okay, carry on, Cal or John.
So, question 3, what near-term and long-term issues or concerns are being considered? So the things I'm going to bring up, these issues affect both short-term operations and long-term planning and have the potential to drive some cost overruns if we don't look at them strategically as time rolls on. So as I mentioned previously, we do a fair share of simultaneous calls, and that leads to greater use of overtime, need for funding part-time staffing, and an increased reliance on myself and the chief to be in operational roles, which could potentially put the community in a place of risk. Say there's a second ambulance call, and him and I often will jump in the second ambulance to take that call during the day because our call department is not available. And if there's a fire or another serious emergency, although rare, there could be a risk if one of us isn't available to serve as an incident commander at a situation like that. We could solve that problem by having a little bit more staffing. So, for example, if you look at our organizational chart, you'll see that one shift is only staffed with 2 people. For the shifts that are staffed with 3, and we get a second call, only one of us has to go, the other one can stay back, and that's really important.
Kelly, have we had some close calls because of understaffing?
We've had potentially some close calls, so one that comes to mind was probably about a year ago during the summer. Him and I were on the ambulance, and there was a call for a drowning at Wallem Lake State Park.
Yeah.
I could grab other examples, and I'm not mentioning it's a doom and gloom, but it could happen, and if the stars line up just right, it could be catastrophic for that person involved in that emergency and our staff not having proper supervision.
How often do we have the shifts where it's just the 2?
So that's 33% of the time because we operate our full-time staff in 3 platoons.
Okay.
So that's fairly regular.
Is that the overnight shift typically?
That is 24 hours a day.
You're a 3, and a 2. Platoon with 2s.
Yeah, so if you look at this chart, our career staffing, one group is a lieutenant, a firefighter, EMT, and a paramedic. Same with the second group, and the third group is a lieutenant paramedic, a lieutenant EMT, and a firefighter paramedic. So on that shift, that third shift, they're always running at 2. During the day, John and I are there from 6:30 to about 3:30 in the afternoon to help them out, but after dark, they're going to calls just them. And even not having that third person on an ambulance call to help carry bags or help with patient care, especially for somebody that's really sick, that puts a lot of extra strain on them. And it's not ideal. I know that's the budget that the constraints we're under, but at some point in the future, we'll have to address that. The other concern with that configuration is, say we get something like a motor vehicle accident, very routine call, we can only send the ambulance. We can't also concurrently send a fire truck where the other groups can.
Okay.
Do the police get involved in a case like that to assist, or?
If they're available, they'll definitely come in and help us in any way that they can. But sometimes they're tied up, especially, the 3 to 11 shift for them I know is pretty busy, so they do anything they can.
But you do call on each other.
Absolutely.
Oh, for sure.
Yeah.
Excellent.
Yeah.
And we'll use the call guys when they're home at night.
Excellent.
Help supplement,
Thank you.
and girls, guys and girls.
So that's just one thing with our staffing. This other bullet point, lean staffing model, I just sort of touched on that. One place where we get particularly stressed is if somebody has to go home sick or has a sick call out in the morning, trying to fill that with part-time personnel is challenging because they're often scheduled at their other job, or they can't just come in on the fly to stay and work an entire shift, which then requires us to hold over the person coming off a shift, and that might require them to work for then 34 hours straight after they've already worked a 24. And they're already working kind of a long week. Because we're in this 3-platoon system, they work average 56-hour work week. Most fire departments are on a 42 or a 48-hour work week, and we're one of only 2 other departments in the Commonwealth that are on that schedule. So Gloucester, Mass, and Munson, Mass also work the 56-hour week. So it's a lot of extra hours, especially if, say, on that overnight, you were up all night doing calls. So sometimes we're concerned about increased fatigue, or somebody saying, you know what, I don't really like this schedule, and I may want to put in for a job at another fire department that has a different schedule, not because they're not having a good experience, but because that's available. And right now, there's a shortage of our industry and lots of job openings, so that's just the brass tacks on that.
So are they working 40 hours and then getting overtime after that for the 56?
After 53.
53?
Yes. So there is some built-in overtime with their schedule, about 160 to 180 hours of built-in overtime annually.
And those who are working 42, I assume, they don't, right, they get overtime after 42, I think,
Yeah,
right?
at those fire departments.
And we just essentially need more personnel to go to the 42, is that
Correct.
Yeah. Okay, thank you.
So I talked a little bit about equipment costs and talked about the turnout gear and some of the other expensive tools we have, like the hydraulic tools, which are on the Jaws of Life that are on our capital replacement plan. We're also dealing with a lot of alternative energy and electric vehicles and solar. So there's certain pieces of equipment we need to purchase to address those risks. Some of it we've gotten under a grant program, and then some of it we're going to just try to piece through on our budget. But they're just new missions and areas we have to address at some point, and just throw it in with the rest of the rising cost for some of these things.
Could you elaborate on that? What are the problems with the solar and all that stuff that's affecting the fire departments?
So one problem, for example, with electric vehicles is disabling them so they can't move while we're taking a patient out of a car, or disabling the batteries or the electrical system if it's been in a crash. And there's a type of plug that we can put in the charging receptacle to disable the vehicle. So we were able to purchase 2 of those under a grant program last year. And then with the new technology, solar battery storage, that's an added strain because we have to go out and do inspections on that equipment and understand those risks if there's a fire in one of those buildings. We also deal with battery fires in small devices like our cell phones. So if, say, my cell phone was on fire on this table, because sometimes the lithium-ion batteries will, it sounds crazy, spontaneously combust, especially if they were cheaply built. We have to find a way to package this up and then get it out of the building. You can't just grab it and run out with it. And don't take my word for it. Google some of these fires on YouTube. They're explosive and violent, so there's special containers and equipment to wrap these in so we can get them out of an enclosed area and safely dispose of them. But that stuff costs money and it's expensive. They're not giving it away. So that's just an example. John touched on the fire apparatus replacement planning. So engine 2, ladder 1, wait times. We had some unexpected repairs with engine 2 as of last Friday. So we just got the bill for $2,200 for some plumbing and pipe repairs because the pipes were just rusted and deteriorated because the truck's 25 years old. And then in terms of looking forward in strategic planning, I think it's important that we continue to explore alternative funding sources, and then while we're looking at that, consider possibly conducting an organizational study. One's being conducted right now in the town of Sutton, and basically the study would give a third set of eyes on staffing levels, organizational structure, and deployment models, so we could really just ensure that our resources are aligned with areas that provide the greatest impact. So that's something that we're looking towards the future with. I realize that is expensive, so there are alternative funding sources, and I hope to have something to bring to this committee or the Board of Selectmen regarding that in the future, because we just want to, make the best use of our dollars and take care of our citizens out there.
Kelly, is that a self-study, or do you bring in an outside group or person to look at it?
It would be a consultant. Yeah, it'd be an outside group, it's a very common thing. We had a study here done in 2009, a manpower study, and that was helpful eventually. I think when it came time in 2016, 2017, geez, I'm having a stroke here, 2017, when we eventually went to a 24-hour day staffing model, even though that study was done several years prior. So I don't want to write it off, but I don't have all the ideas. I've worked here a really long time, and I want to make sure I'm not missing anything. We know that there's going to be potentially better ways to operate our fire prevention and code enforcement division and continue to provide education in the community rather than trying to fit it in around our current activities. We talked about some staffing shortages during the day, and it's possible that we could maybe look to be putting a position on to make an impact on several areas, such as getting the second ambulance out, providing education to students and seniors, as well as fire prevention and code enforcement activities, which right now are being handled by myself and a lieutenant who works a 24-hour shift schedule, and we're just trying to fit it in around emergency calls and all the other responsibilities that we have. It's very often our on-duty staff will handle routine inspections such as smoke and CO for real estate sales, but oftentimes we have to cancel those or move them around because we're out doing emergency calls and we have nobody to go out and do those. And if you're trying to sell a house or do something, I think that's problematic to have to cancel, but obviously the emergency calls, we have to take priority on those, but that's a frustration for us and for them. And then I think last but not least, after the HVAC and electrical upgrades are completed, we'll still need to look at some upgrades and expansion on our current building as time marches on, because we've run out of space for storage and also for the amount of people that work in the building now compared to when the building was constructed in 2000 and it was an on-call fire department. So yeah.
Questions or comments, anybody for fire? So generally speaking, we're minimal increases for all the town departments going forward, right?
Understood.
Yes.
So as you deal with the proposed budget for next year, what's kind of your biggest issue that you're trying to finesse of all the things in that universe?
Yeah, so I think we're going to have to just work within the confines of the current expense budgets right now, based on where the community is at. But unfortunately, on the salary side, we have contractual obligations, which have resulted in about a 5% increase on, I think it was, let me just pull my sheet out here. So 5% on the ambulance side and 6% on the fire. So other than that, the expense budget has not increased, although we've had increases in equipment, contracts, et cetera. But that just means that we're going to have to maybe keep scratching for grant funding and maybe hold off on some replacement of certain things like hoses and turnout gear and stuff like that.
the revenue that we earn in the ambulance side of things, can that help pay for stuff?
It does.
How does it work exactly?
So this year, we're getting $360,000 from the ambulance receipts to go into our operating budget. And
Of the fire department or the
the
ambulance?
ambulance department.
Okay.
The rest of the gap will be made up from, everything else. The reason being is that fund is also used to replace ambulances and the major medical equipment like cardiac monitors. So the cost of 2 cardiac monitors is over $100,000, $120,000. So we're working on strategies to try to improve collections. But again, we're billing mostly Medicaid and Medicare payer, people have that type of insurance, so we can only collect basically a flat dollar amount.
And that's been an issue every year, hasn't
Yes.
it? The billing
For sure.
that you send out, but then the money you get back is less than what you,
Billed out,
yeah.
yes.
You're saying that the majority of the calls for the ambulance, those people are either Medicare eligible or on Mass Health?
Yes, 80%,
Really?
yes.
Wow.
It's the older people that get sick.
Well, no, but I mean, what about everybody under 65,
They're healthy.
Don't they have jobs with health insurance?
How often do we help other towns with ambulance?
That has increased substantially, so I think if I look at the data,
And does that increase the income too, or
Yeah, we can bill for those calls, we go to other towns, obviously, yep.
so,
do we get that money then?
We do.
Pretty well, okay.
but they're probably in the same predicament with the type of insurance. So in 2022, we did about 55 mutual aid calls, and then 23 was about the same. 2024, it went up to 68, and then 2025, it was 111 times. And part of that is we're getting stuck at the hospital where we can't get back quickly, so then we go to another town, and it's like this round robin where everybody's visiting other towns, and then because towns can't replace ambulances quickly, there's wait times, they have trucks that go down. So for example, Northbridge had their ambulance down for quite a period of time,
Lost an engine.
and we had to go over there to provide a lot of mutual aid. So did Uxbridge, which they would do for us if we were in that
Right.
predicament, but that's what's driven that. You can't, if you have an issue with an ambulance, you can't get a loaner and you can't get a new one.
So you mentioned cardiac events, you have to go to UMass. Now that Milford Regional is UMass, they're still not equipped, they don't have the...
They don't have the 24-hour care and the specialties and the catheterization lab where they can actually do an intervention to unblock a clogged coronary artery, which is essentially what a heart attack is. They have a diagnostic cath lab there where they can just see that there's a problem and then make a decision from there, but they can't take any steps to make that problem better.
How is the state responding to the concerns of all the town fire departments about this cut in federal grant money? Is there talk of the state stepping up, or is it scrambling for grant money going to be a real issue going forward?
I think it's probably going to be an issue going forward.
Do you?
Because everyone's having, it's the whole country, federally, and it trickles on down to the state level,
I've spoken with Senator Fatman and Representative McKenna about these issues, and they're well aware of the challenges in fire EMS, and I know especially Senator Fatman is working to try to address them, but...
There's only so much money, isn't there?
Yeah.
Yeah, Carol, go ahead.
So are we bringing in about $360,000 a year then? Is that what we're bringing in?
It's higher than
I
that.
think, and maybe Gene can help us with that number.
For ambulance, you mean?
The ambulance, yeah.
Last year, FY
Yep.
25.
Yep.
There's one date on here. was 480,000.
480.
So, 81.
Yeah.
So we use this for a transfer for the operating budget, as well as we try to withhold some to save for an ambulance.
That's one of the things that I don't think people in town realize. They see how much they're paying to run the ambulance, but what they don't realize is there's money coming in too that's helping to offset that. But the way towns don't do it like you do your home budget, and so you don't really see it that way. But and I mean, I've been in this town for many, many, many years, and the level of service and the professionalism of what our departments are now, it's unbelievable. And it's, they're saving lives, and it's just, I mean, they're top notch. I don't think they're any better in a city or anything else than what we're getting right here in Douglas, including our police and our fire department and our, it's cost us some money, but I'll tell you, it's worth every dime we've paid.
When it's your family.
Right, right.
You don't want to hear.
Yeah.
So, need to.
They're definitely professional people now, and you got to pay for professional people.
Right. Any other? Heather, you got any questions for the fire folk?
No, good to go. Thank you so much.
Okay. Any other questions? Anybody? Comments? All right. Thank you so much.
Thank you.
Thank you very much.
Thanks for everything you do for us.
Thank you very much. Appreciate it.
All right, Justin, library.
Hello.
So you guys all got the library thing I forwarded to you?
It's kind of nice we get all this stuff ahead of time.
I like it.
Yeah. I knew the weather was going to be sketchy, so I tried to brief you very thoroughly in advance.
So Justin, we read it over, but you have some highlights you'd like to point out for us?
Just, the last year's been chaotic. We literally spent about 5 months getting hardly any new books into the library because our distributor collapsed and there wasn't a way to get new books. I tried to go to Barnes & Noble. They won't sell books to libraries because they're in the same boat. But, the Baker & Taylor was the biggest, the giant, distributor to libraries, to the entire North American independent book selling market. And they just kind of collapsed unexpectedly starting from June into August and left a massive hole in the market. And the second biggest competitor, Ingram, wasn't able to ramp up production and start getting deliveries out until mid-January. So for about a 5-month period, we saw
a year ago? Or
January, just this past, about 4 months, about 4 weeks ago, we got a shipment from UPS with 30 boxes. He just pulled out that back and was like, I don't know what to do with this. I was like, well, this has never happened before, but this is everything we've ordered since last August coming in all at once. But despite that, circulation numbers went up. Not because of anything we did, because we weren't getting new books on the shelf, but the need, increases with sort of, the chaos of the times. So when people are stressed, whenever they're not comfortable, the libraries are one of the first institutions they turn to relieve, some of their financial pressures and budgets because, there's a lot of things we do for free, as evidenced by, the value of the services we've provided on the second page. And I expect no matter what we do, demand in the upcoming years is just going to keep ramping up. So I'm kind of looking at doubling down on traditional services, just, trying to keep the books flowing. The trustees have been building up these accounts you see on the last page, trying to save up for, a modest kind of ADA, a way to make the library more accessible. Not a huge project like we're about to see, Upton and Whitensville undertake under the auspices of the Massachusetts Board of Library Commissioners, but something that we can try to make fit our budget, and making our building accessible as it is instead of adding what the state thinks we need. But, other than that, we're just kind of clunking along. I remember 2 years ago, we were talking about the big budget increase. Whenever we got the $100,000 added, we were able to extend our hours. This past year has been a chance to sort of dial back a little bit to gauge how much we overstepped. And I feel like we did overstep a little bit because we were hiring 2 brand new library assistants to cover hours we had never covered before. Now I have 1 seasoned library assistant management plus Pages who can pick up that burden. We can shed that staff, save the town some money, and get us back, I think, in sync with where, we should be as responsible stewards rather than where we, could be if we were not.
So Justin, I noticed you've got almost 300,000 for your capital fund reserve for building renovation. Where do you hope that will go? I mean, at what point do you pull the trigger and do renovating?
That is the question we're trying to ask ourselves right now because, the board wants to be able to accomplish, a full, making the building compliant, but that takes an accessible restroom. It takes, some internal modifications for pathways and things because our shelves go all the way to the floor. They go up too high. There's not enough space. We don't have an entrance anywhere that's ADA compliant, and it's not easy to make one because our basement is actually below grade level. But I'm kind of hoping that with Matt's help, he's gone, and, talking to the BFCC in the upcoming years, because we've got, the 300,000 almost, ready for building renovation, but also the unrestricted donations and grants is at 57,000. And that's what the trustees have kind of been saving for planning purposes, so that we don't have to, say, can the town give us money to plan what we want to do, and then potentially end up with, another dud project that is not able to get funded.
Do you have an estimate, though, of what it would cost?
The MBLC cost estimate says that the Massachusetts Board of Library Commissioners, regardless of whether it's new construction or building renovation, if they estimate out their square footage estimate puts us at around $4.5 million. But we're really kind of hoping we can find ways to turn that number lower by, considering putting in a Lula lift instead of a full-size elevator. Rampage where, stairs and elevators might not be practical, and just, sacrificing the things that aren't 100% necessary. Because, there's what the state thinks we need to provide library services in Douglas, Massachusetts, and there's what we think we can use to supply library services in Douglas, Massachusetts. And we don't think we need a $14,000 or a 14,000 square foot renovation to do what we do.
And grant money from the state?
Grant money in the state would be contingent on that. So if you want a case study, Whitensville and Uxbridge are both in the program right now. Whitensville has their plans posted online on their website, and that's what they're going to be trying to get funded probably next year or the year after, whenever they come off the wait list. That hasn't been estimated out yet. Right now, everyone feels very good about, how the plans look and everything, but, whenever they come to, having to pass the campaign, there's a little bit less optimism just because of, it's a hard task to get across, it's a hard goal to get to even in the best of times. And, these are not the best of times in terms of building market and stability and being able to figure out escalation costs.
And what's Uxbridge working on?
The same thing, exact same thing. They're just a little bit farther behind in the process, so their plans aren't online yet.
So they don't have prices yet on what this is going to cost?
Nobody has prices yet.
And it's a lot of stuff that the state requires. You have to have an owner's project manager. Northbridge took down the old St. Patrick's School. Cost them $1.8 million to take it down, all right? The owner's project manager added another $600,000 for somebody to push paperwork, and this is what the state makes you do. So these are some of the things that
It's also just what we have to do to the buildings. The state would not help us build a library if it didn't have a 100-person meeting room in it.
Right.
And how are we going to cram that on our little parcel on Main Street?
Right.
We're not, realistically.
You people are definitely going in the right direction with what you're trying to do.
I hope so.
Yeah.
So Justin, in general, other than the building renovation, it sounds like financially things are going along okay with the library. Is that a fair summary?
I think so. We've never become contingent on the grant money that comes from the state or the federal governments. So that's why we've been able to build up this unrestricted donation grants number, is because we haven't been using that to pay staff or buy books like a lot of other libraries have. So if it dries up, it's not the end of the world for us. Since we got our budget increase, 3 years ago, or 2, whenever it was, that put us so far ahead of where we were before, we still kind of consider ourselves ahead of the game and lucky to be where we are. So yeah, we're good.
And one shift that you were doing as you got more money was more stuff available digitally, correct?
Now we're kind of shifting back because Overdrive did not interface well with MHEC when state contracts were being negotiated this fiscal year.
Really?
So the cost per circ licenses, which I've been relying on to kind of bump up our electronic circulation, aren't as cost effective anymore. They went from being like, $1.50 per circ if somebody happened to borrow something to about $2 per circ, which is a big percentage increase, and then pushes that out of the threshold of what I'm willing to pay for something, for a lot of like these books. And the regular models, what they did is there was a 25% increase across the board for ebooks, audiobooks in Overdrive. That's what we use for Libby. So if you use the app, that's where it comes from. And they made our audiobooks start expiring after 24 months. So we have to pay more for them, and we don't get to keep them forever. So we kind of want to send Overdrive a message as a state and vote with our wallets to say this is not going to be acceptable next year.
Are people checking out physical books more? Or are they moving away from the digital?
Everything is moving up more. People haven't moved away from the digital. What I have done is, like, used to, I was in, like, if it was below a certain cost threshold, I enabled it. So if you logged into Libby, you would be able to find millions of titles, whatever you wanted. Now, I don't enable it unless somebody has it on hold, which makes it kind of a lot more targeted collection. It means we're not seeing as much of a breadth of readership, but people are still reading the same quantity of stuff. It's just more kind of unified in a smaller pipeline, if that makes sense.
So as we look ahead to the budget that we'll vote on in May, the proposal for the library is not keeping you awake at night then? I mean,
No, we're very happy with this. The trustees have approved it. Matt has looked at it, and we're all happy with it, even though it's an underride.
Question.
Yeah, go ahead, Sandy.
How many full-time and how many part-time employees?
We have myself, circulation librarian, children's librarian, and archivist as full-timers. We have 1 part-time library assistant and 2 part-time pages, and 1 fill-in substitute.
Very good, thank you.
You're welcome.
Anybody else? Questions for Justin?
Yes, sure. So how many square feet do you currently have in the building?
I think 4,200.
On 3 floors, including the basement?
I don't think that includes the attic space because it's technically not finished.
Okay. So just the 2 floors, 4,200? And what's your physical circulation? Hard number of books?
Hard number of books like that we have in the collection?
Yeah. About
39,000.
Okay. And how much of the space you have does that occupy? I think I know the answer, but...
I mean, almost all of it.
97, 98%? Are we...
Probably. I mean, we've gotten very creative with how we put things around the edges of the walls and make little holes in walk spaces, but if we were to be ADA compliant, we would probably have to shed about 1/4 of the collection.
Okay. And then, do you have physical real estate to expand at all?
We have behind the library, up to, are you familiar with the lot?
Not in the back.
Not in the back. Like the town owns like all the way up to the sidewalk of the building behind us. So there's actually quite a bit of room back there, but not enough for state standards. It would be more than enough for Douglas, but
not enough for state standards for any expansion, physical expansion?
Not enough to qualify for MBLC construction grants under any guise they have right now.
For grant money. And then you quoted $4.5 million. What was that for? For just renovation? or an expansion and a renovation?
That would be the cost just on their estimate, of square footage of what it would cost to renovate our current space as it is, without any
As it
additional
is,
space.
ADA compliant, but no expansion.
Exactly.
Okay, all right, thank you very much. Thank you.
Okay, anybody else? Heather, any questions for Justin?
No, I just love the expansion of the programs and love hearing all the updates. Thank you.
Thank you.
I have one quick question. Can you talk about the delivery program a little bit?
Gail, if you call the library or email us, it's pretty simple. Gail just goes out in her pickup truck on Thursdays and delivers to whoever is enrolled in the program. We currently just use MapQuest to generate the shortest route.
Is MapQuest still a thing?
It is.
Wait, you deliver books to people?
We do.
There you go, Lynn.
It's been funded by the Friends of the Library since the pandemic. It's one of the things that we started. A lot of libraries started doing delivery, and a lot of started doing curbside pickup. Nobody in Douglas wanted to do curbside pickup. We started the delivery program. Most people have kind of matriculated out of it since then, but we do have a regular list of about, I would say, 15 to 20 people that we deliver to, not every week, but about every other week.
Wow.
And whenever patrons are sick, they can call and just be added to the Thursday delivery route. And we wanted to bake that into the budget this year to shift that to the municipal budget so that the Friends can just focus on other things. They're like, we've been paying for this now for 5 years. We think it should be a core service the library absorbs now.
Nice.
Are you paying for gas, or are you going to plan to hire like a part-timer to do it?
Our circulation librarian does it, and
Yep.
this is just the reimbursement for her mileage at the federal rate.
Okay. And are most of these people seniors, or are they?
Most of them are seniors.
Most of them are seniors. Okay.
A lot to Riddlebrook and to Hayward Landing.
Okay. Great. Thank you.
Thank you.
Anybody else for Justin?
Yep.
All right, thank you for coming.
Thank you.
Thank you, Justin.
Good luck.
Thank you.
All right, Matt's not in the room. Let's look at minutes then, everybody. January 27. Sandy had a thing she picked up, right, Sandy?
Yes, I'm no longer the vice chair. That's Rob Leonardi.
Yeah, so we have, the minute taker will have to update that. Sandy is no longer the vice chair. Rob Leonardi is, but I think Sandy still has her reserved parking spot.
Right.
Yeah.
And the stipend.
Oh, yeah, the big stipend.
All right, anybody else on January 27th, other than that correction of the vice chair? All right, can we have a motion to accept the minutes of January 27, 26 with that one amendment?
So moved.
Sandy moves.
Second.
Second by Ryan. All right. Any discussion, anybody? All right. All in favor, say aye.
Aye.
Do we need to?
Oh, we got to go roll call.
Oh, that's right. Yep.
Lynn, why don't you start?
I'm going to abstain because I wasn't here, so.
So Lynn Mazzulli abstains, right?
Yes.
Yep. Sandy Kuiper's aye.
Ryan Hogan, aye.
Carol
Vandenberg, aye.
Gogol, sorry. Carol Gogolinski, aye.
Rob Leonardi, aye. Howard D'Amico, abstain.
Adam Moore and I.
Okay, so that passes with 1, 2, 3, 4, 5, 6 yeses and 2 abstentions.
Correct.
Is Matt around?
He's on a call. Do you need him tonight?
Well, if he has something to share with us. But if he doesn't, then we will carry on, so. All right, Gene, let's go through upcoming meetings in a minute. You had emailed us that, but can you just go over those for the record? Why don't you come to the table, okay? So, Feb 24.
Hello.
Hello?
How are you?
Good.
Excellent. I'm waiting to see.
Please identify yourself for the record, ma'am.
Oh, sorry. Well, I need to. Okay. I'm Jean Lovett, Finance Director, Town Accountant, for those who don't know me. We did some scheduling. I still have some departments to fit in and to see if you want anybody other than the ones listed here.
Okay.
So February...
Like February 24, let's just go through it.
February 4th, I have the Highway and Public Building Maintenance. Adam Furno is the department head both of those departments.
Yeah.
I may try to see if I can get water sewer that night. I don't know if they had their meeting with the commissioners yet. March 10th is going to be your heavy meeting. I have Council on Aging, or Douglas Senior Social Center, Douglas Public School, and BBT. So that's going to be a heavy one. March 24th, I have everybody under the umbrella of the Board of Health, the nurse, the landfill, monitor wells, and the transfer station. And then the other two meetings are blank right now. I do have to fit community development in, as well as capital.
So the warrant closes, I thought I read that somewhere.
I don't know the answer to that.
Beginning of April, end of March.
Because I think...
Because we have time, the printing and the mailing and the...
I think as much as possible, we'd like to see a rough draft of it before we meet on April 14th, right, so we can read it over.
We did schedule April 7th. I'm trying to get community development as close to that date as possible in case they have any public hearings, so we don't have those to be continued items.
Are you pretty certain, Jean, that we will need to meet on April 7th then? I have it down as tentative, but...
That's where I'm seeing the warrant, for your first review of the
That would
warrant.
be our first time to talk about the warrant itself, would be on the 7th, and then the 14th.
Yeah.
So we would then do our recommendations on the 14th?
Right. All right, any other suggestions for Jean in terms of the schedule or comments? Everybody comfortable with who we have tentatively before us, or are there some departments that haven't been mentioned you think need to come? Okay. All right, Mr. Wojcik, anything for us at this point?
Just quickly, I'm juggling a lot of balls here tonight. I just need to manage everybody's expectations. As we get deeper into the budget process, I'm not getting good news. I'm just getting bad news all the time. And there are going to be some things that are prudent to put into the budget but make it more difficult to balance the budget. The fire department in particular, you heard what Kelly's correct, 5% on the fire side, 6% on the ambulance side for the bottom line increase. And that's driven almost entirely by our approach to budgeting overtime. And in the past, we've used our best estimates. So scheduled overtime, we can figure out because we have a scheduled rotation that we can run out through the whole year and plan for the scheduled overtime. In the past, we used roughly 16 shifts of full-time coverage for someone either going on a vacation or sick or whatever. 16 shifts is nowhere near reality. It's really more like 4 times that, almost. Because you've got 8 people, each taking their vacation, and so it's more like 50 or 60 shifts that need to be covered. Now, call people can cover full-time shifts, and that's less expensive than not getting time and a half. But as a budget practice, we always plan for the worst and hope for the best. So we need to have an adequate overtime budget and an adequate part-time or call department budget to cover our maximum exposure to the use of benefit time by the full-time staff and still have enough money in the budget for the call to cover call staff when they're coming to an actual call. They're not covering someone else's shift. They're responding to a fire or to an EMS emergency. And over the years, this has been a bit of a dance back and forth. I think Deputy Chief has done a marvelous job of really digging in and documenting where those budgets need to be. But that's what's generating the large increases. Those large increases have set me back because I'm not getting any play to the upside with everything I do in the rest of the budget. I take 1 step forward to get 2 steps back. I got the cherry sheet with preliminary cherry sheet with Governor Healy's proposed budget, and I entered all the revenue numbers in. I'm like, yes. And then I went to the assessment side, and school choice out is up 110, 120,000. So that's not on their side, it's on the municipal side, and so I went right back to where I started. That's kind of the pattern that we're in. I think we have a very difficult outlook coming up from the Douglas Public Schools, and that's going to be a very difficult process. I'll let that process play out on the school side with the school committee and with the administrative staff there. I'm going to just tell you, I can't help you any more than I have. Like, the municipal side has been more or less frozen in terms of our expense budget now for almost 3 years. And on the compensation side, we did comp reform to try to get things in line with the market, but we don't have the same rate of increase that we might have had if all these new employees were on a step 10 system. They're on a step 3 or step 4 system. So I'm not feeling real good about where we are at this point. I wish we had better prospects for good news, but we don't. The health insurance renewal will be in March. Property casualty insurance renewal about the same time. I'm somewhat more optimistic about the property and casualty, but in the health, there's really nothing I can do. The only other thing that I'm putting into the budget that I just want to flag for your attention, and I've got to get back to that call because it's about litigation, is the budget that we had for conservation. At one time, we had a part-time staffer, and it was a half salary. And I did not cut that out of the budget. I let the employee go, or the employee retired, or however you want to, doesn't matter to me, he's not here anymore. And we put that into a vendor account. So we moved it from the compensation line to an expense line. And we have allocated funds for the vendor to provide us with office support and day-to-day things that are not covered by the 53G account that the conservation agent typically draws from when they do work in the field. To the extent that we haven't gotten that service, or that service hasn't really been useful to the taxpayer, the Conservation Commission has asked for us to consider hiring a conservation agent. Well, we can't afford the full-time staffer. But then I received an inquiry from the town manager in another community looking to partner with us to share a conservation agent. And it makes a tremendous amount of sense, just given the trajectory of the two communities, the workload, and the fact that it won't cost us a whole lot extra. They're going to have to pay us, and they may be willing to do so to get a higher level of service. The employee would be domiciled in Douglas as a full-time staffer, but on the revenue side, you would get a revenue stream for 50% of the salary. In this budget environment, I'm not super excited about adding any kind of heads, but in this particular case, if you look at our workload at the Conservation Commission and the development pressure on this community, we really need to protect the taxpayers and the community overall from folks who may not want to follow the rules, but more importantly, we need to protect applicants from sloppy processes. So we have a professional staffer who is getting that application in for a subdivision or for something else, and they're able to act upon it immediately and make the 53G assignment and follow it through and make sure the Conservation Commission has all of the information needed to make an intelligent decision in 1 or 2 meetings instead of 4 or 5. That improves the standing of the town of Douglas with all the people who do business with us. So I think it's an important step forward, and frankly, we're just going back to the notion that we need at least a half-time professional wetland scientist to...
Question on that. Would we be responsible for pension and all that stuff? Does that...
I don't know how pension works with these...
And benefits for...
All of that would be loaded into the cost.
Yes, but it's perpetual. It goes on into, pension goes way up forward. So I don't think you would adequately get compensated enough. Why can't the other town hire? Why does it have to be Douglas?
Because it's going to be a lot cheaper for you. Because our benefits are way cheaper than theirs.
Yes, but if you're hiring an employee, then aren't you responsible for benefits and...
You divide that cost with the other community, and you'd be dividing
for
a health benefit
into the future.
As long as they work here.
But don't you have them when they retire as well, for retirement?
Not necessarily. They'd have to vest.
But you won't know that in the front side.
We won't know that in the front side. If they're going to last 10 years or not, I can't tell you where we're going to be in 10 years.
It's what you said, they were going to pay half the salary.
No, half the fully loaded cost of
That
having the
wasn't the
employee.
word that you used.
Yeah, thank you for correcting me.
That's what I heard.
No, 50% of the fully loaded cost of carrying the employee. Yeah, absolutely.
Would this be a multi-year agreement or a year-by-year agreement?
No, I prefer a year by year because I think we need to get out of it if we don't want to stay in. So that's an absolute thing. I'm not going to disclose the community because my peer hasn't had a chance to brief his governing board, and I want to give him a chance to do that before I. But it's, I mean, how hard can it be? We have.
So what are we doing at this point with, like, how are we paying at this point? Why can't we continue with that rather than hiring somebody? I think we're in a budget crisis. To talk about hiring somebody is.
Well, first of all, you're going to pay this money anyway. Somebody has to do the work. So the budget has $45,500 in it for a conservation professional.
Right.
So community development today gave back $5,000 or $6,000, and that would be our share. Right? So that's going to keep going. Somebody has to do the work. I just went through all the issues. Are applicants well-served? No. Is the board well-served? No. Is the loading of conservation work onto my community development staff interfering with their ability to do other community development activities, including writing grants? Yes. So, I mean, this would be a choice that's over my head. It's a reorganization. The select board will make the choice, but I'm going to recommend it because I feel like I don't want to get into a spot where economic development or some other issue is delayed because we can't provide the staffing support.
Matt, what's the timeline for when you'll finally get all the numbers you need from the state and other moving parts?
You won't really know the final numbers from the state until it's too late.
Yeah.
The town meeting we'll use the most recent version of the preliminary cherry sheet that we have.
It's like that every year, isn't it?
It is,
Yeah.
it is.
It used to be February, it's now July of the next fiscal year.
Yeah.
Will we have the BVT numbers for when we meet with them?
I did request a presentation March 6th. If they're coming in on the 10th, I asked that it would come in the Friday before.
Okay, but will we have the numbers of students or no? I don't remember when that comes in.
We'll have a pretty good idea.
I would hope that he would have the potential assessments.
October, so.
Okay.
Could I ask something on
Go
this?
ahead, Carol.
I mean, I'd like to see this other town that you're tied in with more than a year. You're only tied in for a year. Now we have this person. I've been around here long enough to remember when we were looking to lay off some of these people because the economy totally collapsed, and you know that we don't pay into an unemployment system. So if we have to lay them off, it all comes right out of the town. So they get in for a year, and then they change their mind, and now we've got the whole thing on us. We don't have any choice but to take the whole thing.
Correct.
I'd like to see-
No, I'm not going to accept any of those assumptions. Those are incorrect. If the other town pulls out, we're out. We'll go back to the situation
Well,
we had with the
how are you going to get rid of that person that you've hired?
They're not guaranteed employment.
But
If
they're
it's
going to
subject
the
to
unemployment office, and we're going to pay the unemployment.
a fraction of the salary for 16 weeks, maximum.
It's a pretty good fraction.
No, it's not actually. It's not good money at all. And we
And
self-insure on that.
that's because right now it's 16 weeks. Remember when they were running them out to like 39 weeks and stuff?
Right, and how is our community not being served at this point? I don't know, I'm just,
Well, that's research you'll have to do.
I will.
If you don't think you need the staffer, then ask the people who work in that department whether or not they need the staffer. I'm telling you, I work here every day, and I think that's where we are. But I don't go into these disaster scenarios, conspiracies. I just can't. If someone doesn't work here anymore, they have to be eligible for unemployment, but we're not paying for their benefits anymore. We wouldn't be paying their full salary anymore. All those things would come off. So that's a risk we have with every single employee we have. They could leave when we pay the unemployment. We've had people that fired got unemployment.
right, so
I
there's
went through
the
the hearing
risk in
process. I
hiring.
contested it.
Oh, yeah, they'll give it to them.
Yeah, I can't win those.
They fire them. and they
So that's
give
why
them
you
unemployment.
prefer not to hire somebody, because there's
Right.
great risk.
Right,
You've got to prove that you really, really need it.
yeah.
But
Anyway.
I do want you to hear from the people who go through our process to understand the frustration of being continued and not having paperwork in order, and then talk to the staff that work in that department and see how much time and energy they're spending serving a board that doesn't have staff to support it.
So Gene, through
Hey, go ahead,
Dick,
Jeff.
obviously, so when we meet with community development, can we make sure they're aware that these questions go up, and maybe have someone from the Conservation Commission come as well, just so we can understand the issue?
Do we have a date for,
No, I was waiting for BBT,
okay.
and I also wanted the town meeting, I'm looking at hopefully March 24th for them.
Okay. Anything else, Matt?
I want to circle back. I really need to get on a call, but in the fiscal '27 budget, we will take $430,000 from the ambulance restricted receipts account to support the operations of the department. In the department's budget request, I haven't signed off on this because I think I want to reduce it, but the budget request is $702,000. So there's about 270 grand is actually coming out of the general revenues of the town. And they've also bought their ambulance with the same account.
Right.
So, I don't want to begrudge them the money they need to operate, but just so the taxpayer understands, there's a huge subsidy here from the users of the product, and that's what makes it sustainable. I see a very different future in this line of service, and I shared this with the chief and deputy chief today. 10, 15 years from now, I think we're going to be talking about regional fire districts and local ambulance, because it's the only thing that makes sense. We want the ambulance close to the people. We had 10 structure fires last year out of 1,000 calls.
Right.
So
What was that, Matt?
10 structure fires.
Okay.
They had a lot more calls than that because they do investigations, strange odors and brush fires and whatnot. But in terms of that big heavy-duty event where you see lots of people, who's responding? The whole district. It's a district event anyway.
Oh, yeah, when I had my neighbor's house caught on fire, I saw trucks from about 7 different towns show up.
Yep.
That's how it works. Everybody goes to the run card.
Yep.
So
Does the first alarm?
it's got to be local.
Yeah.
But it's all about how you configure your stations, right? Configuring your stations may be more efficient for 5 or 6 communities than when you do it each individually. I'm going to go try to get us some
Yeah.
money by getting...
All right.
Thank you, Matt.
Thank you, Matt.
Thanks.
Thanks, Matt.
All right, anybody have anything else for us? Gene, do you have anything else?
I don't. I wanted to know if you wanted Bob and Eric before you.
Is he working on anything specifically now?
Well, he can update you on the projects, and that he would be the one.
North Street still one of the projects? or-
See, these are the good questions for Bob.
Sure, absolutely. If you can fit him in, that would be great.
He's
Still
brought a lot of
no
money, in,
tenant
so
for the-
bring him in.
Cubes?
The big building down there by Pine?
That's, yeah, I don't know what the status of that is now.
Yeah. Well,
Yeah.
Bob.
Bob.
All right, anything else for Jean, anybody, while we have her here? How you feeling, by the way?
Yeah,
I'm doing well, thank you.
Post-surgery, are you?
I'm doing well.
feeling good?
Because the-
Oh, good.
I had bypass.
Oh, well.
Yes. Yes.
On a scale of 10, where would you say you are, energy-wise?
Oh, I was going to say, I would say for all in our listening audience.
Keep that offline.
You could tell us later. All right, anybody have anything else? Heather, you got anything for us?
No, I don't.
All right, let's have a motion to adjourn.
Motion to adjourn.
Standing moves, second by Rob. All right, we need roll call vote. All in favor, say aye.
Aye.
You got to say your name.
Oh,
though,
Lynn Mazzulli, aye.
Sandy Kuiper's aye.
Ryan Hogan, aye.
Dick Vandenberg, aye.
Carol Gogolinsky, aye.
Rob Leonardi, aye.
Howard D'Amico, aye.
Heather Moore and I.
All right, we adjourn at 8:17.
All right.
Thank you,
Awesome.
everyone.